Mr. Russell, how are you?
Good.
Good. I'm Anna Catherine. I'm going to be your nurse today.
Okay.
Can you tell me your name and your date of birth?
Daniel Russell, 10/28/1986.
Good. Can you tell me where you are today?
Anderson's Hospital.
Okay. Can you tell me what today's date is? The month and the year?
August 2019.
Good. A pain scale of 0 to 10, 0 being no pain and 10 being the worst you've ever had. Can you rate your pain for me? 2? And that's just in your knee?
Mm-hmm.
Okay, good. When was your last bowel movement?
Earlier today.
Everything was normal?
Yep.
Okay. Any problems going to the bathroom? Pretty regular?
Yep.
Okay, good. I'm going to be doing a quick physical assessment on you, just looking you over from head to toe, okay?
Okay.
Won't take me long. Okay, I'm going to start with your eyes. I'm going to dim this light. Just look straight ahead for me, okay? Good. I'll turn the light back on. Okay, and follow my pen with only your eyes, okay?
Okay.
Good. Can you open your mouth for me? Okay, I'm just assessing his mucous membranes, which are pink and moist, in your nose. Good. Next, I'm going to move to his arms. I'm looking for any signs of redness, edema, anything that may be of concern. Are you having any pain in your arms?
Nope.
No pain or tenderness? Okay, good. His skin is warm and it's dry, which is how it's supposed to be. So next I'm going to move to his skin turgor, which is on the back of his hand. I'll pinch the back of his skin and it falls promptly, which assesses his hydration status. If it was an elderly patient, you would want to assess it on their chest because their skin in the back of their hand tends to stay standing. Next, I'm going to move to his capillary refill, and that returns within 3 seconds. And that also returns within 3 seconds. Next, I'm going to check his pulses. I'm going to check his radial pulses at the same time. And those are equal bilaterally. I'm going to check his brachial pulses at the same time. Those are equal. And you never want to check the carotid pulses at the same time, so I'm going to check this side first. And then this side. Good. Okay, can you push my hands away? Good, and pull them towards you. Good. It's just assessing his upper body strength, which is good. Okay. Next, I'm going to use my stethoscope. I'm going to listen to his heart sounds. I'm going to listen to lung sounds, and I'm going to listen to bowel sounds. So I'm going to start with his heart sounds, and I'm going to name these as I go. Okay, this is his aortic, pulmonic, tricuspid, and mitral. And I can hear heart sounds in all 4 locations. Next, I'm going to move to his lung sounds. Can you take a deep breath for me? Good. Okay, I'm going to listen to his lateral lung sounds. Good. Okay, I'm going to have you sit up. I'm going to listen to your lung sounds on your back, okay? Okay, I'm going to start at the top, and I'm going to listen down your back, okay? Can you take a deep breath for me? Good. Good. And while he's sitting up, I would go ahead and inspect his back. I would inspect for any redness, any signs of any skin breakdown from him laying in a hospital bed. If he did have any skin breakdown, we would want to make sure that area was protected, so we would go ahead and put a dressing over it to prevent any further skin breakdown, and prevent any pressure ulcers from forming. All right, you can go ahead and lie back down. All right, so now we are going to do his abdomen. So, do you have any pain in your abdomen? No pain? Okay, good. So the first thing we want to do is inspect. So I don't see anything abnormal in his abdomen. No distension, everything looks okay. So next we're going to auscultate, which means listen. So I'm going to listen to each quadrant of his abdomen. In each quadrant you want to listen for a full minute, and you want to hear 5 to 35 bowel sounds in each quadrant. So I'm going to start in his upper quadrants.
Hungry.
All right, and I hear very active bowel sounds in all 4 quadrants. And next I would want to palpate his abdomen. If the patient does state that they have any pain or tenderness in their abdomen in any of the quadrants, you would want to palpate that area first. But since he doesn't have any pain or tenderness, we would just want to gently palpate and feel for any abnormalities, anything that may be distended that's not visible with the eyes, and nothing feels abnormal. Okay, so we're finished with the upper body. We can move to the lower body. So we start by just inspecting his legs, inspecting for edema, redness, swelling, anything that may catch our eye. Then we would want to feel. We would want to feel for any edema, make sure we don't have any pitting edema. We would want to feel the fronts of the legs, the backs of the legs, maybe any blood clots, any signs of blood clots. I don't feel anything abnormal. So then we would want to move to the feet. We would want to inspect our capillary refill, and we would want to do that on both feet. Return within 3 seconds here. Returns within 3 seconds here. There is a bit of a temperature difference with the legs here. This left leg is pretty warm, and the right leg is a little bit cooler, which I assume is circulation from the right knee surgery, circulating from these toes and this tight dressing. But that is why we assess the capillary refill, and the capillary refill on this foot did return within 3 seconds, so there's nothing to be concerned about there. Next, we're going to assess his pulses. So for his pulses, his femoral pulses, you want to do that skin to skin. So in this case, I'm not going to pull his pants down in front of the camera. So I would go under his skin and go to his skin here and feel his femoral pulses. And I can feel both of them. Okay. And then his popliteal pulses. And those are equal. And then his pedal pulses, which are on the back of his feet, the tops of his feet, excuse me. Good, those are equal. Okay, can you press like a gas pedal? Good. And can you pull them back towards you? Good. All right, I'm gonna check his reflexes. I'm not gonna check his reflex in this knee, only this one. So just let me hold it, okay? So I want to find the soft spot in his knee, which is about here. And you just use my stethoscope. And I had a muscle jump here, so reflexes are there. All right, the next thing I would want to do is assess my patient for any drainage tubes, any IVs, anything that they may have on them. I want to check for patency to make sure that they don't have any IV fluids leaking, anything needs to be retaped, anything, any bags of fluid empty that may need to be rehung. And then I would want to inspect for wound dressings. In this case, my patient does have a wound dressing, so I would want to put my gloves on before I touched any wound dressing. So I would roll his sleeve back and assess the dressing. And in a hospital case, the dressing will have a date and a time on it, and possibly the nurse's initials of when the last time the dressing was changed. You'll also have an order of how often the dressing is supposed to be changed. In this case, it's Q 72 hours, so we're changing this every 72 hours, and it will be changed tomorrow. So it's okay right now, but if the dressing were to be saturated for any reason, or you were to see a lot of blood or a lot of mucus, or the patient is complaining of anything bothering them, or if it's hot, any signs of infection, then you could of course go ahead and change the dressing or take the dressing off just to reassure the patient if there were any concerns there. Pull his dressing back up. All right, Mr. Russell, how old are you?
32.
32? Okay. When's the last time you saw a doctor for a physical exam?
It's been about 3 months.
3 months? Okay, you know you're supposed to have that done yearly. Okay. Do you exercise?
Yep.
You do?
Yep.
Okay. 3 times a week for 30 minutes?
Probably going to be doing more of it once my knees fit.
Okay, good. All right, that's recommended 3 times a week for at least 30 minutes. And just making sure you're eating right. But not as much fast foods. Take it easy on the soft drinks, not as many soft drinks, lots of water, 2 to 3 liters per day. Making sure you're getting your adequate amount of nutrition, your vegetables. Okay?
Yep.
Do you have any questions for me?
Nope.
No? Okay, well at this point I would leave my patient comfortable. I would make sure their side rails were up, their call bell was within reach, their water pitcher was full, and I'd make sure that they knew that they could call for me if they needed anything. And that's all.